Assalamu alaikum. Today on Nuran Academy, we discuss Al-Zahrawi and the sacred mastery of modern surgery. If you benefit, please support by subscribing and sharing as a sadaqah. For most of human history, the very thought of surgery was, it was terrifying. The idea of cutting into a living human body was just wrapped in so much fear and complete uncertainty. It was really seen as this barbaric last resort, a crude, dangerous gamble where, so often, people weren't saved by the procedure, they were lost to the attempt. It felt like healing had its limits, and this was far beyond them. But in the heart of Islamic Spain, there was one physician who decided to choose skill over superstition. He looked at this terrifying act and saw the potential for profound healing. And through his work, the entire field of surgery was about to be reborn. His name was Al-Zahrawi. Now, to really grasp how incredible Al-Zahrawi's work was, we first have to picture the world he was living in. This was a world pretty much without any kind of systematic surgery. It was an era defined by sheer guesswork and fear. So, the reality of an operation back then, it was grim. These procedures were rare, they were crude, and they were done with whatever improvised tools were on hand. Pain management was almost non-existent, and the knowledge, it was all over the place, totally unstandardized. What the world was crying out for was a system, a real method. It needed clear techniques, ethical rules, proper training for doctors, and of course, tools that were actually designed to save lives, not just, cut. Al-Zahrawi came from Cordoba, which at the time was a global hub of knowledge, but his approach to medicine wasn't just intellectual, it was deeply, deeply spiritual. He operated from the belief that the human body is an amana, a sacred trust, given to us by Allah. And that one belief, it changed everything. This core belief led him to ask a really powerful question, one that would shape his entire life's work. He basically reasoned, if our Creator permits us to heal, then why on earth should we let fear get in the way of learning exactly how to do it properly? It was this amazing shift from just hoping for the best to actively pursuing disciplined, life-saving knowledge. So that's what he did. He trained with incredible patience, he practiced with the utmost care, and, this is key, he wrote everything down. All of this meticulous work came together in his masterpiece, an encyclopedia that would literally write the book on a new systematic science of surgery. He called it Al-Tasrif, and it was absolutely colossal. We're talking about a 30-volume medical encyclopedia. This was so much more than a book. It was a lifetime of careful observation and hands-on practice, all organized for the benefit of every generation to come. He dedicated an entire volume just to surgery, and honestly, there was nothing else like it in the world. This wasn't abstract theory. No, this was a practical how-to training manual. It was packed with step-by-step instructions, clear diagrams of anatomy, real-world case studies he'd worked on, and even crucial warnings about common mistakes to avoid. But Al-Zahrawi was brilliant enough to know that technique alone isn't enough. To perform these delicate, life-saving operations, a surgeon needs tools that are just as precise as their knowledge. And this is where he took medicine from the age of improvisation into an age of true innovation. Get this, he personally designed over 200 different surgical instruments. It's just incredible. He wasn't only a doctor, he was an engineer of healing, crafting the exact tools needed to work with the human body safely and effectively. And his genius is so clear when you look at the tools he invented. Many of them are the direct ancestors of instruments used in operating rooms right now. We're talking about scalpels for making precise cuts, forceps for gripping, tools for cauterization to stop bleeding, and even the very first dissolvable stitches, which he made from catgut. So all of this incredible discipline, it makes you wonder, what was the moral compass that guided his hand? What was the principle behind the blade? For Al-Zahrawi, it was a place where incredible skill had to meet profound humility. And we know this because Al-Zahrawi himself told us. In his writings, he laid out the guiding rule. He warned surgeons, only operate when it's absolutely necessary, and just as important, only operate when you have the knowledge to do so. For him, skill without a deep sense of responsibility and humility was just plain dangerous. And his whole ethical framework, it came directly from the core teachings of Islam. The principle to first, do no harm.
The beautiful idea that precision and excellence in your craft is actually a form of worship. And of course, the sacred teaching that to save a single life is as if you have saved all of humanity.
So when you combine that faith, that science, and that engineering, the impact was just monumental. His work didn't just stay in Cordoba. It spread across the known world, and it ended up shaping the entire course of medicine for the next 500 years. Once Al-Tasrif was translated into Latin in the 12th century, it became the standard surgical textbook in European medical schools, and it stayed that way for 5 centuries. The modern operating room and everything that happens inside it can trace its lineage directly back to the principles and tools documented by this one amazing Muslim physician.
Ultimately, what Al-Zahrawi's life and work show us is this beautiful synthesis. It's that when the compassionate desire to heal, which is mercy, is guided by deep, disciplined knowledge and skill, which is mastery,
then the act of healing itself is elevated. It becomes something more. It becomes a form of worship, a true expression of one's faith through serving humanity. He took fear and turned it into technique. He took pain and turned it into hope. He chose the difficulty of mastering a skill so that countless others could live. So we want to leave you with this to think about. If he could lay the foundations of modern surgery over 1,000 years ago, what life-saving skill will you master now? Presented and created by Norhan Studio.